Nutrition is the cornerstone of good health. In 2012, at the World Health Assembly, members of the WHO adopted the resolution of setting up the global nutrition targets set for 2025. In 2014, the WHO issued the Global Monitoring Framework for Maternal, Infant and Young Child Nutrition, with the aim of establishing how to monitor the progress towards this initiative. The idea was to reduce the global number of stunted children to 40%, reducing anemia in women of reproductive age by 50%, reduce low birth weight by 30%, cut the number of child obesity, increase breastfeeding in the first 6 months by at least 50%, and reduce and maintain childhood wasting to less than 5%. The Seychelles, as part of the global community, had its own challenges. It had to make sure that data and correct informations were being collected against the various indicators which will be used to measure its performance in dealing with those pressing health challenges. Consequently, the World Bank also published its Systems Approach for Better Education Results, SABER, in which Seychelles was included in 2013. It was then clear that collecting data in many areas, including health, was a huge challenge.
In that report, one of the main weaknesses for Seychelles with regards to early childhood development is that there is no systematic way of recording and keeping data. And also these data are just there scattered all over the place, and they could not be retrieved and analyzed.
I suppose although data exists, administrative data exists in various ministries like the Ministry of Health, but probably the way the data is managed or the way the data is stored was the biggest challenge. Because as we all know, having data on paper, which can be stored in files, which could be in various different places, there is no proper management system in place. So to be able to gather all this valuable data, I would say, that exists out there was a challenge.
The Seychelles therefore took a commitment that proper data collection for better policy and decision-making was imminent.
This was quite, I would say, a tall order from Vice President Ford at that time for us as a country to address this issue.
The Institute for Early Childhood Development, IECD, was given the mandate to kickstart the project with various experts and stakeholders in the country. Serious attention was put on data collection in the sectors of health and education.
So we decided to start the project with the Ministry of Health because this is where early childhood actually starts.
We are in contact with children all the time. The children of that age group, early childhood, are always in contact with us in the programs that we deliver for them.
For all the key players, it was an eye-opener.
It has been an interesting project. It's an eye-opener because it has pointed out that there are a lot of data collection or information that we were supposed to collect as a country, as a healthcare agency or as a health provider, that we were not collecting, and this was highlighted clearly.
The Ministry of Health took it very positively because they claimed that they have a lot of data.
A country like Seychelles that has achieved universal healthcare, the way for us to really go to that higher level, that higher quality of healthcare is to address the key concerns such as non-communicable diseases. And for us to better understand, we need to look at the development of each individual Seychellois, and that starts as a child. So a lot of the problems that we are facing within the health sector are linked to non-communicable diseases issues, and we need to measure those right from the point of conception.
From the very beginning, it was clear that not only was it important to collect data, but these data needed to be managed. Paying close attention to the Denver Development Screening Test, DDST, which is a widely used assessment of examining and identifying children with development problems, as well as their progress, some key recommendations came out.
My involvement came about in 2016 in collaboration with the Health Ministry. We looked at the development milestone for the early childhood. 2 key recommendations came out. One was that the health sector needed to install and implement or deploy an information management system, and they needed to relook at the way they conducted the assessment for the Denver program as well.
This project is also interesting because it also highlighted the challenges that we had.
So we've been able to include the collection of those data in our regular panel of data that we collect on children.
For this project, since it is something to do with data management, looking at putting together an information system and data management system for reporting on key ECC indicators, so we convene a group of people who directly work with these indicators, with the collection of these indicators on a daily basis.
It's cross-cutting because it gives you much more information to then be able to make sure that you're also targeting the right areas, those critical areas that make the most difference. And we all know generally the first years of a child's life are the most critical in terms of their development.
That was, I think, the biggest project that we embarked on in collaboration with the World Bank Group. Using the WHO standards and reference 2006, we developed 13 indicators, but for the purpose of the pilot, we looked at 9.
It's estimated that in 2017, Seychelles had an average annual birth rate of 13.7 per 1,000 persons. From the point of conception and early in their pregnancies, women are followed up closely. One of the indicators and data being collected is the aim of reducing anemia in women of reproductive age by 50%.
My name is Denise Machot, and I've been working for the Ministry of Health for the past 20 years. Currently, I'm working in the maternity unit. So for the past 20 years, I've worked in different settings, but basically doing antenatal checkup. For this program, we've been collecting a lot of data regarding the blood investigation, basically the hemoglobin level, and also at the antenatal clinic, we screen mothers for gestational diabetes. And this is a condition that is on the rise, unfortunately, in Seychelles. And the pattern is that for the past few years, we've seen a rise in both the gestational diabetes and also mothers presenting with anemia, meaning they have a low hemoglobin level.
According to the International Food Policy Institute, in 2011, about 5,000 women of reproductive age had anemia. This was about 21% of the total population of women in reproductive age in the Seychelles. Today, an antenatal nurse at the Le Mamel Clinic is advising a mother on dealing with her anemia.
Most mothers, you will find that they lack iron in their diet. And when they first come for their booking, meaning their first antenatal checkup, we screen them for anemia. And these tests, we find that these mothers already, they come with anemia for their pregnancy. And also during their pregnancy, they are at much higher risk of developing this condition.
Data collection is an important aspect of our care. It informs us for any change in our service delivery. Collecting and analyzing data allows us to follow up closely on our indicators in pregnancy, especially as some of these indicators have a direct impact of the outcome of the mother and the baby. Antenatal care within the healthcare agency is decentralized in 10 community health centers around Marie, Pral and Lading. And we also have one high-risk clinic that pregnant women can be referred with any problems, obstetric problems, that is at the Seychelles Hospital.
The antenatal clinics around the country are playing a key role in collecting the much needed information on pregnant women in Seychelles, which is key to monitoring progress.
Normally we collect data on a daily basis, and we do it on a daily basis, on a weekly, and then finally it can be monthly or annual data. And we ensure that these data are being collected, and these data will provide us with significant feedback for us to be able to find how the rate about anemia and also gestational diabetes.
Another key moment where much important data is collected is at birth itself. Just above 1,700 babies were born in Seychelles in 2018. The target is to reduce low birth weights by 30%. Raw data for this indicator are being collected on maternity wards.
I've been working with the Ministry of Health for the past 31 years, and on the maternity unit, it's 29 years of service. We are specifically targeting the low birth weight, and as you know, low birth weight is an important determinant for the infant survival and future development. We have a prevalence of about 10%, and usually it's the low birth weight, it's about weight below 2.5 kilos, and we can categorize it into very low birth weight, which is less than 1.5 kilos, and extremely low birth weight, less than 1 kilos. Most of the time, it's associated with preterm birth and intrauterine growth restriction. The baby is not growing accordingly. There are different contributing factors. There can be social issues, common amongst young mothers, nutritional factors, medical conditions, other issues like drug abusers.
Birth weights are recorded by maternity nurses at the Seychelles Hospital as well as on the inner islands of La Digue and Pralin. The maternity ward of the Seychelles Hospital has also been accredited as a baby-friendly hospital endorsed by the WHO and UNICEF since 2015.
For us to be accredited, we have to follow the 10 steps of breastfeeding. We must have a policy, all our staff must be trained, and we encourage mothers to breastfeed exclusively for 6 months.
According to the WHO, if breastfeeding were scaled up to near universal levels, about 820,000 child lives would be saved every year. It is estimated that only 40% of infants under 6 months of age are exclusively breastfed. The target is to increase this by at least 50% by 2025. Breastfeeding has a lot of benefits for both mothers and their infants.
We do a nutrition surveillance in the community. So we collect data from the nurses, and it's actually quite shocking to find that the rates of breastfeeding in the community continues to decline. So when the moms are in hospital, they are more likely to breastfeed their child. But once they go out in the community, we find there's a drastic drop. From the data we collected last year, the rate of breastfeeding at 6 months was 6%. And that's very low. When you know that we recommend mothers to exclusively breastfeed their kids from birth to 6 months, so it's actually quite alarming to find such a low rate in the community at that age. And I think the issue is that there's a lot of publicity, a lot of, I think sometimes the internet can be a wrong source of information. Parents think that infant formula is better, but breast milk is actually better for the child and the mom. For the babies, it will help prevent infection. It actually helps with the development of the child. It helps with the maturity of the organs of the child. It actually helps prevent the mom from it reduces the risk of certain forms of cancer, like breast cancer. And of course, it's free. There's no cost with breastfeeding.
It's readily available, it's nutritious, it has all its components in it, it's easily digestible.
There are many reasons why mothers may choose not to breastfeed. The researchers here in Seychelles are also paying close attention as to why some mothers choose to stop or do not breastfeed at all.
We actually advocate a lot for the moms to breastfeed, but we know that there are many factors, such as moms having to go back to work early. We know our maternity leave here is quite short, and a lot of moms find that they feel like they have to introduce that formula before they go back to work. Whereas we encourage moms to express their milk, store that milk, and continue to provide your child with the breast milk for as long as possible. So even when the child turns 6 months and they start to eat, you can still continue to breastfeed. So complementary feeding is exactly that. It complements breastfeeding. So we add it on to the breast milk.
To make sure that women are sensitized on breastfeeding, the maternity ward ensures that various promotional materials on breastfeeding are available on the ward. A helpline is also available for the mothers after they've been discharged for any inquiries. Regardless of all, some mothers are very conscious and choose to breastfeed.
I chose to breastfeed because I know that it is good for the baby and also for myself. I have an 8-year-old daughter, so I breastfed her exclusively for 6 months. So this is my second child. But because of work commitments, I breastfed exclusively for 4.5 months. Like I said, I chose to breastfeed because of the numerous benefits it has for myself as well and for the babies.
Benefits like the rich nutritional values of the mum's milk. And thereafter, what children eat is crucially important to make sure that they are well nourished and are eating healthily. Again, according to the World Health Organization, malnutrition is responsible directly or indirectly for about 1/3 of deaths among children under 5. The WHO claims that well above 2/3 of these deaths are often associated with inappropriate feeding practices occur during the first year of life.
In 2018, I was nominated as chairperson of ECC for the health sector. And we've been able to come up with several projects in the past 2 years. And I mainly focused on looking at nutritional status of children below 2 years in the first 1,000 days, focusing mainly on growth. So looking at how the food intake of children is particularly looking at breastfeeding and when parents start to introduce complementary foods from 6 months, how that impacts on the growth of children in terms of whether children are at risk of becoming obese or having issues like stunting and wasting. We only had 40 children, to be honest. But you can already see there are issues because we have some of the kids, I think at least 10% of them were obese. So we did have a bit of stunting and wasting as well. I think it would be useful for us to do another project on a larger scale with a larger group of children and also maybe include that aspect of anemia in there to see how food intake of the children has an impact on anemia outcome as well.
Nutritionists worldwide agree that what children eat is crucial for their development. 30% of children worldwide are stunted, meaning they are of low height for their age. The target is to reduce stunting by 40%, whereas globally, 52 million children under the age of 5 are wasted, meaning they are underweight for their heights. The aim is to reduce and maintain childhood wasting to less than 5%. The issue of nutrition is taken seriously that there is a global strategy for infant and young child feeding which aims to revitalize efforts to promote, protect and support appropriate infant and young child feeding.
There is an issue with food intake here in Seychelles. Most likely it's to do with the environment where you have access to so many different foods here that not necessarily healthy but cheap. And I think it's the types of food being introduced to children at a very young age. So from the time the child starts to eat, the pattern and the types of food being introduced, the nutritional value of those foods, all of those things have an impact in the long term. So you can already see there's a problem. There is a big problem here in terms of food intake, the quality of the foods being offered, the quantity of foods being offered. So we do have the issue of obesity, and we know that already amongst adults and children above 5 years. But it would be useful for us to know below 5 years what's happening. Like I said, the earlier we're able to intervene, the better, because then you're able to prevent that child from growing up to become obese. But then on the other side, you also have to think about all those children who are not getting enough. So those who are undernourished, those who are at risk of being stunted. It's a smaller number, to be honest. It's not like a big number, but ideally you want it to be zero.
This is also why children below 5 years are constantly monitored in community clinics across the country. They measure the height of the child, their weights are monitored, and parents are constantly advised on the types of food they need to be feeding their children. This is also one of the ways where data can be effectively collected.
I work with the children from 0 to 4 years old. And on my day-to-day activities, I do the weight check, the height monitoring, the head circumference, the arm circumference. And also with that, I collect data about the breastfeeding pattern of the parents. And I could say more or less most parents, they do cooperate when we are collecting the data, and they do turn up for the appointment that we give them for us to be able to collect the data. With the parameters, when you measure, you can see that more or less above 90% our children are within the normal range that it is requested according to the WHO. But with the analysis of the data, it will give us a broad perspective whether from the data that we have analyzed now, whether it is really the picture that we are looking at or it is another perspective. And from that analysis, then we can also compare us with other countries.
Nutritionists are also present in primary schools where they engage with teachers and the young pupils to see the eating patterns, types of food and quantity of food these young kids have access to. Again, all in mind is the possibility of proper data collection.
Based on our consultation with parents that we usually have, we find that parents give a lot of processed foods. So things like burger, chips, a lot of the packet foods, you know, like twisties and all these sorts of things. Juice, a lot of parents think that they have to give juice from the time the child starts to eat at 6 months, but you don't have to. Like I said, we recommend natural foods, so fruits, vegetables, local tuber, sweet potato, cassava. Less processed is best. And usually we advise parents not to add things like butter, margarine, oil, and salt below 1 year, because then you are introducing another taste for the child, and they gradually have a likeness for sweet foods and salty foods. And I also like to tell parents, when we think about a child, you know, parents like to accuse their child when they come to see me. You know, this is what nutritionist is saying, but the child doesn't know about sausages and burgers and chips until we as parents introduce them to these sorts of foods. So I think the message here is that us as parents, we need to take our responsibility. We provide foods to our child. So if we start by giving them healthy foods, we will not have any issues because kids are going to get used to what you give them.
The journey for all has been very opportune for the discovery of useful data, which would help all involved in measuring the progress being made in childhood care and development. Proper documentation, guidelines, and monitoring framework have been set up to keep tab of progress and challenges ahead. The ICD and all its partners have ensured that all the key players are properly trained in efficient data collection and in the measuring of all the key indicators.
The biggest benefit is that we have been able to analyze the data that we have to show us and give us some information, some indication of how well the children in Seychelles are developed based on these indicators.
Having this data collection process where you've got information on the child, not only on the child but on the mother, you've got it disaggregated by age, by sex, by geographical location, by disability status, by all the different things, variables, then it's easy for you to know specifically what exists to be able to calculate your indicators, because at the end of the day we want a national indicator framework to be able to monitor progress.
I mean, talking about sustainability, the project, I see it as an intervention. Intervention to show us that there are more information we can collect to look at the well-being of our children.
With that increased data, we can make better choices about the resources that we put in. We can also make better decisions about where to focus our efforts in terms of, for example, new tests and new screening that we want to bring in that can help us better support the development of our children.